Modified citric pectin, a scientifically validated ancient Chinese remedy with therapeutic potential in multiple conditions. Modified citric pectin, MCP, a derivative of natural pectin from citrus peel, is chemically and thermally processed to obtain a smaller molecular structure, which allows efficient absorption. MCP has been shown to have multiple therapeutic effects through complex mechanisms and is used in various conditions. 1. Immunity stimulation and anti-inflammatory effects. MCP supports the immune system by activating NK natural killer cells and cytotoxic T lymphocytes, helping to combat infections and chronic inflammation. It has antimicrobial, antiviral, including SARS-CoV-2 virus, antibacterial, and anti-inflammatory effects. 2. Galectin-3 inhibition, anti-cancer and anti-metastatic effect. Galectin-3 is a protein with a central role in inflammation, fibrosis, pulmonary, renal, hepatic, and cancer progression. MCP acts by inhibiting it, preventing the adhesion and migration of cancer cells, thus limiting the formation of metastases. By blocking galectin-3, MCP helps to reduce angiogenesis, slowing the development and migration of tumor cells. Modulate the immune response by activating NK cells and cytotoxic T lymphocytes, which contribute to the identification and destruction of tumor cells. Decrease chronic inflammation, a major risk factor for cancer progression. 3. Cardiovascular protection, anti-fibrotic and anti-inflammatory effects. MCP has beneficial effects on the cardiovascular system, especially in patients with type 2 diabetes and heart disease. In a recent study, MCP was shown to protect the heart by reducing inflammation and oxidative stress, reducing the damage caused by heart disease, inhibiting apoptosis, preventing cell death in heart tissue, improving heart function and reducing cardiac fibrosis, preventing the replacement of healthy tissue with scar tissue. 4th, hepatoprotective effects and combating drug toxicity. In the case of drug-induced toxicity, anti-tumor, MCP has demonstrated the ability to protect the liver by reducing oxidative stress and inflammation. In an animal study, MCP helped reduce leukocyte infiltration and liver degeneration, decreasing biomarkers of liver toxicity. MCP supports liver health by limiting oxidative stress and reducing inflammatory markers, such as IL-6 and TNF-alpha, decreasing the activation of STAT3 proteins, molecule that regulates gene expression in hepatocytes, preventing damage induced by toxic compounds. 5. Reduction of pulmonary, hepatic, renal, myocardial fibrosis. MCP acts as an anti-fibrotic agent, inhibits galectin-3, decreases inflammation, reduces inflammatory markers, thus preventing the accumulation of scar tissue in various organs, lungs, liver, kidneys, and heart. 6. Improvement of diabetic nephropathy and renal protection. Diabetic nephropathy is a major problem in type 2 diabetes. MCP has been shown to be effective in protecting the kidneys by reducing oxidative stress, inflammation, and renal fibrosis, contributing to the maintenance of renal function. The effects include reduction of blood glucose levels and renal histological damage, restoration of the balance between antioxidants and free radicals, protecting the kidneys from oxidative damage, decrease of inflammatory and apoptotic mediators, limiting inflammation and fibrosis in the renal tissue. 7. Cartilage protection and osteoarthritis relief. A study in osteoarthritis demonstrated that MCP, in combination with hyaluronic acid, reduced synovial inflammation and protected articular cartilage. Notable effects include suppression of inflammation and reduction of joint pain and stiffness, improvement of metabolic processes in the joint, preventing cartilage degradation. 8. Detoxification of heavy metals. MCP is known for its ability to bind to heavy metals, facilitating their elimination from the body. According to studies, after administering MCP, 15 grams for 5 days, followed by 20 grams on day 6, urinary excretion of arsenic increased by 130%, cadmium by 230%, mercury by 150%, and lead by 560%. In another study, children who took 15 grams of MCP daily experienced an average 161% decrease in serum lead levels and a 132% increase in urinary excretion. 9. Improve erectile dysfunction and reduce fibrotic inflammation. Erectile dysfunction, ED, especially that of arteriogenic origin, can be associated with vascular inflammation and fibrosis in the penile cavernous tissue. A recent study showed that MCP can reduce inflammation and fibrosis in patients with ED by inhibiting galectin-3 and its signaling pathway. Treatment with MCP contributed to decrease local inflammation and fibrosis, thus improving erectile function. Protect cavernous tissue against damage associated with atherosclerosis and chronic inflammation, suggesting that MCP could be a promising therapeutic strategy for improving erectile dysfunction. 10. Improves digestive health. MCP helps support healthy gut flora and may have a positive effect on digestion, reducing symptoms of digestive disorders. 11. Studies suggest that modified citrus pectin, MCP, by improving the gut microbiome, may have multiple health benefits, reduces inflammation in cases of burns, improves liver function in hepatic steatosis, fatty liver, and attenuates allergic reactions. MCP helps support the integrity of the intestinal barrier and reduces the pro-inflammatory activity of pathogenic microorganisms, thus creating a favorable environment for overall health. MCP 3xBiotics, a combination of MCP from citrus peels, sweet orange, pomelo, and mandarin with polyfloral pollen fermented in SCOBY cultures, stands out for its multiple beneficial effects on health and has a high safety profile, being a promising option in the prevention and treatment of complex chronic conditions. Kidney and cardiovascular diseases, osteoarthritis, cancer, erectile dysfunction, liver toxicity, etc. Choose the power of nature with MCP 3xBiotics. Visit pronatra.ro and enjoy optimal health.